Cancer. For how long shall we suffer?
The latest loss of key political leaders in the country over cancer has brought about fear amongst Kenyans. This comes even as the government intensified its efforts in combating cancer menace.
Number one is the environmental issues. See, deterioration of environment itself in the world is increasing the high risk for many diseases and led by cancer, number one. Number two is adulteration of the foods, water, daily commodities, everything. Number three is the stressful life.
According to the Kesses member of Parliament, Mishra Kiprop Arab Chilule, is that there is need for the government to use all the possible avenues by setting up the modern cancer center. Apart from the proper infrastructure, Mishra Kiprop, the vice chair of the Parliamentary Health Committee, says there is need for the health personnel.
Without health education, there is no health personnel. We need indigenous health personnel. Number two, technology transfer. Technology transfer from other countries to bring and train and go away.
Safaricom CEO Bobu Kolimo, Kibra member of Parliament Kenoko, and Committe Governor Joyce Laboso join a growing list of the people dying of cancer. And the deadly monster claims about 32 lives annually. For Mishra Kiprop, the leader should not politicize the war on cancer, but deal with the real issues affecting both the rich and the less fortunate.
One man dies who is a rich, who is corrupt, who can make news, breaking news. You go there. Thank you very much. You got the answer. So, when two people, somebody died, a big man, so that is the time we make news and we make chaos and we talk. But every day, my dear, it is there. They are dying every day.
Cancer is a huge menace in Kenya, and its treatment requires more investment so that both the rich and the poor can afford the therapies.
Out of 10 laymen, none of them know what is cancer. But they will tell, oh, cancer is a killer. Oh, cancer is a very costly disease. Oh, cancer is a taboo. Oh, cancer is the failure of government. Hey, cancer is now a black magic. So many people so many things will say. So, somebody will say cancer is a tumor or a growth. But nobody knows what is cancer.
Each day, at least 1 or 2 people are diagnosed with cancer. Kenyans have been advised to take advantage of the free cancer screening across the country. Dr. Mishra Kiprop, however, says some local medics had established a working relationship with foreign hospitals to refer patients to facilities, even for the ailments that could be treated locally.
A kidney transplant, we are doing 1.4 million Kenya shilling in Eldoret Medical, suppose. So, in India, if you go air ticket for both the accompaniment, for accommodation and everything, 3.5 million.
This has attracted huge bills for the cancer patients. The first-time member of Parliament has now proposed a health amendment bill of 2019, which seeks to regulate medical tourism in the country.
India is doing good in medical tourism, but there are a lot of conmen, both in India and Kenya. What is happening? There are people who are middlemen, who are brokers. The disease which can be treated in Kenya, they are taking innocent Kenyans, and poor patient, they are getting 100 to 200,000 shilling commission. Number one. Number two, we don't know this innocent patient. Before getting his diagnosis and management from the hospital and the doctor, he is guided by a non-medical conman crook on the street of Kenya. Every tall building of Kenya or Africa has a wellness clinic in the name of this owned by crookeries.
Reporting for Ebru TV, I'm Jeff Khaemba.